So we're in the month of March, and it is Colorectal Cancer Awareness Month. And to give everybody information, I have my good friend, Dr. Paul Williamson from the Colon and Rectal Institute of Orlando. He has been a surgeon for how many years now?
35.
35 years. So we just have some awareness factors that we want to make everybody familiar with. So, first off, um, what are the risk factors that we're looking for when it comes to colon and rectal cancer?
Well, I'm going to frame this up by saying, these awareness months for colorectal cancer and breast cancer are actually to bring education to the population about those that are interested in their health and being proactive in their health, what they can do to extend their life expectancy and not have problems. Colon and rectal cancer is the fourth leading cause of cancer in American population, and we see about probably 150 to 156,000 new cases a year. It lags behind breast cancer, prostate cancer, and lung cancer, but it is something that is totally preventable and has to do with education on what you can do to prevent it in your life, which is looking at what causes it, how you recognize it in yourself, and when you should present yourself to a medical doctor for screening. So the actual risk factors to colorectal cancer is 55% of the cause of colorectal cancer in America is actually lifestyle, related to lifestyle, and we get it as we get older, and that has to do with your overall health. We live in a world now that is more obese than we ever have been since the 2000s, and obesity is definitely a risk factor. High body weight index is a risk factor for developing cancer. Smoking is a leading cause of a risk factor. Obviously, family history, which we'll talk a little bit about. People who don't exercise are more at risk, and obviously your diet, what you eat, is a huge proponent of your risk of developing this type of cancer.
Well, so talking a little bit about the family history, it's going to make somebody a little bit more motivated when a parent or a grandparent or an aunt, uncle, a blood relative has dealt with this before. Obviously there's time frames where you suggest people to get tested. Colonoscopy obviously is the number one recommendation that you guys have. When it comes to family history, what are your recommendations and age ranges that you would want people to get scoped, so to say?
It's a great question, Dan. As physicians and particularly as surgeons, we stratify patients into risk categories as to whether or not they should be screened and how they should be screened. So patients who have had a family member who has had not only previous cancer but also polyps, they're at an increased risk than, say, a low risk population that doesn't have that family history. So generally, if you have a family history of a primary degree relative, which is a mom and dad or a sibling, you recommend that they be screened at least 10 years prior to the age that their primary degree relative was diagnosed with the cancer.
Okay.
And those are things that are really important for patients to understand. And there are a lot of patients out there who don't know their family history, so it's prudent for everyone to say, "Hey, mom, hey, dad, tell me about our family history and about our cancer incidence," because a lot of that is not talked about as dinner table talk.
So outside of family history, what about symptoms? What symptoms are we looking for, to make us a little bit more aware?
Sure. Colon cancer per se almost always arises in the age group, the low risk population, or those that I described earlier as lifestyle. The number one factors that polyps are abnormal growths within the colon that become larger with time, and they usually will start bleeding. So the number one thing to look for as far as symptoms is anal bleeding or rectal bleeding. usually painless bleeding. The other one is an abrupt change in bowel habits, which we always ask patients about. Most people have their own regulated bowel symptoms or systems, and if those change abruptly and last for a great period of time, that can signify something going on in the colon. Abdominal pain is a late symptom of a colon cancer. It can be crampy abdominal pain or crampy pain associated with a change in bowel habits. The problem with colon cancer is that a lot of times it's very occult and doesn't give symptoms, which is why we start screening patients prior to them developing symptoms.
And the screening tool that is most recommended would be the colonoscopy, correct?
Yes, this is an arena that has been looked a lot at about what's the most effective screening tool, and obviously a physical exam of the colon is probably the best way, and looking at a patient for skin lesions or changes in what they look like applies to what the inside of the colon looks like, where you can actually see abnormalities, you can actually see polyps. So colonoscopy has become the #1 screening tool for patients who need to be screened for polyps or tumors. There are other screening tests on the market.
Something that obviously if somebody isn't able to get in for a colonoscopy or is even scared of getting a colonoscopy, what is another tool to
That's an interesting point you bring up. Back in 2000, as late as 2000, only about 20% of the population of America was screened. Now we're about 61%, so we're doing better. There was a push to try to get 80% screened patients in Florida screened by 2018. Florida is good. We're now at 71%, so we're almost there. But in terms of screening, the reason that not a lot of people are screened, and there are states in the Midwest that are really lagging, it's because of not being able to access health care, not having the funds to do it, low income populations. So the other tools that have been used for screening, which is high sensitivity guaiac stool test, Hemoccult test to test for blood, the FIT test, that's the immunohistochemistry, which looks at whether or not there's blood specifically to humans in the colon. That's another well-known test. And then the Cologuard is a multi-targeted test. It looks for DNA that may be sloughed by tumors. It's a very expensive tool. It's not accepted by all insurance companies. And then the Hemoccult test or the FIT test should be complemented with endoscopy or even an office exam of the lower colon every 5 years.
So if a person, watching this and, becomes aware of what they need to do, they contact their primary physician, and going into their primary care office, as we have affiliated with our office, it would be probably more of would they be able to order the FIT test?
Absolutely.
And they would be able to get the Cologuard done in the primary care office. But obviously, the tests like the colonoscopy, the endoscopies, those have to be done under the supervision of someone like yourself in your office.
Absolutely. So going back to the stratification of patients that need to be screened, if you're low risk, if you have never had a problem, if you don't have any symptoms, don't have any bleeding, no change in bowel habits, and you don't have a family history, you're a low risk that should be screened. And the guaiac stool test or the FIT test can be ordered by your doctor. Those are tools that you use in the comfort of your own home, and you do the test and send it in, and it is read. If it's negative, it's great. If it's positive, then you would be referred for a colonoscopy. And it's very important for patients who want to be screened by those tests that if it's positive, then colonoscopy is the next test.
Okay, so without family history, then let's talk about age ranges. What ages are we looking at that we need to start looking at getting screened?
Yeah, well, the American Cancer Society and the Task Force for Prevention for Colorectal Cancer has been looking at this for years, since the 1980s, and the trend of mortality and morbidity for colon cancer has really gone down with screening, which reached a peak around 2000 because everybody became aware that we're not going to smoke anymore and we're going to be screened. So we had a great impact on that. And it's usually for older populations, but that has a tendency to mask what's happening in the younger age group, where we've seen a tendency toward rise in colorectal cancers in the 20 to 29 age group, and more importantly, the 40 to 54 year age group recently. So in 2018, the task force in American Cancer Society recommended that you be screened even earlier, 45. And aside from that is that the populations who are at greatest risk for colorectal cancer, even the subpopulations, are the non-Hispanic Black population, particularly males. We're seeing that in younger age groups. So that type of patient that comes in, I'll even screen them earlier. And you really have to ask very specifically about symptomatology, because anybody who comes in with any type of symptom, even if they're 20 or 25, I think should be discussed. Okay, we're going to treat you, but if this continues, we're going to bring you in here earlier for screening.
So let's talk now about prevention. This is what people really need to know. Now they know the factors and things to look for and what to test for. How do we prevent? How do we prevent this problem? I love a good hamburger. That's one of my favorite meals. Yeah, but talking to you, doesn't sound like that's the wise choice to make when it comes to prevention. So what do we need to do for prevention standpoint?
Well, I said earlier that 55% of or over half of the colon cancers that we see today are called sporadic cancers, and they occur in the population that don't have hereditary risk factors. And if you think about it, there are things that you can do to prevent your risk, and there are things that you can't do. Hereditary is not something you can do anything about. You just need to know about it. Or if you have inflammatory bowel disease, you can't do anything about that. You just have to keep that under control, which is a medical issue, but you can't personally do anything about the fact that you inherently have a risk factor from your hereditary. On the other side of the coin, there are modifiable risk factors that you can do everything about. And as a population, America's obese. Where the average BMI of Americans is 30 now, and it should be well down in the 2021. So trying to reduce your weight. Obesity has a great deal of risk factors to developing a lot of different kinds of cancers, but most importantly, intestinal cancer. This has everything to do with what you're putting in your system too. Processed foods. The colon is supposed to absorb water and process waste, but the processing of food has taken out the inherent value of fiber. And so fiber is very, very important. Fluid is very, very important. Most Americans don't drink enough fluid during today, particularly water. And a lot of the processed foods that we eat may have some substrate that is contacting the colon over a period of time, causing these issues. So
you were saying red meat?
Red meat has actually been labeled in the past as being a pro-carcinogen, and you should limit your intake of red meat to less than 50 grams per day.
That's my burger question.
And it's a lot of people eat processed meat. You're talking about turkey and ham and processed meat.
So like your actual like lunch meats and those types of things? Okay.
You should keep those to a minimum.
And fried foods, obviously?
Fried foods are really no good for you for a lot of different reasons. But the other risk factors that are important are smoking. Smoking is a huge risk factor, and part of the decline in the incidence of colorectal cancer came with becoming a non-smoking environment. We noticed a great change with that. Exercise is important. You should get some daily exercise. It has been shown to be a direct impact on your development of colorectal cancer. There's some other things. Aspirin has been shown. Aspirin a day, 84 milligrams, may have some protective effect. Calcium may have some protective effects. But basically, and alcohol is also a risk factor. So less than 3 drinks a day.
What about, I'm sure a lot of people might want to ask, what about a probiotic? What if we take a probiotic? Any effect there on positive?
I don't know of any, what we in clinical medicine have prospective randomized studies that have shown that probiotics have anything to do with the development of colon cancer. I think it's probably going to be coming out, but you can buy probiotics from anybody, even Amazon. You can get probiotics and you really don't know what you're getting. So that study really, to my knowledge, hasn't been done to see if there's an effect on preventing that.
Okay. Well, Dr. Paul, I can't thank you enough. You and I have been good friends now for quite a while, and this is Dr. Paul Williamson with the Colon and Rectal Institute of Orlando. I would recommend him over anybody, but he has a great group of doctors that he works with Orlando Health, and if you guys have any problems, any questions, of course you can contact our office. You can contact Access Integrated Primary Care. They have a great primary care physician and PAs in there, and they can get you connected with Dr. Paul's office, and that is the Colon and Rectal Institute of Orlando.